Two things. I wear size 11 shoes. What's the importance of that, you may ask? I have a habit of putting my foot in my mouth, and today is going to be absolutely no exception. Because wherever there's an inconvenient truth to be told, you must not back away from it. Two, since assuming the role of minister, I have never, ever been introduced correctly. My name is correct, Terrence Deyalsingh, the honorable, temporarily I will hold that. I am a minister, I am from Trinidad, but I am not the Minister of Health. Because what I have found is that I am the Minister of Health Care. Trinidad and Tobago has spent $40 billion in health care from 2005 to 2016. But are we healthier? The answer is no, and that's where I put my foot in my mouth. I am the Minister of Health Care. I am the minister of providing scalpels to amputate legs. I am the minister of providing anti-diabetic drugs, health care. I am the minister of providing statins, free health care. I am the minister of providing methyl dopa, health care. I am the minister of providing anti-cancer drugs to combat lung cancer due to lifestyle diseases, health care. That is what I am. I am not the Minister of Health. There is an inconvenient truth to be told. And this is what I think the heads of government did in 2008, was it? 2007. They recognized that in the Caribbean, if we do not face up as a society and a region to this inconvenient truth, what we have today is people dying before the age of 70 due to lifestyle diseases. So in spending $40 billion from 2005 to 2016, and we have Professor Carl Theodore here, professor in health economics, who could tell you that all of that money has been wasted. Because we amputate more legs today than we did 20 years ago. If as a society we had paid attention to the Framingham study out of Boston, we would not be in the position that we are in today. But we don't have to go to Boston for solutions. When we did our own St. James study in the 1990s in Trinidad, Dr. Hospitalis will know about that. If we had paid attention to the St. James study, which tracked diabetes and hypertension, and paid attention to that study 20 years ago, we would not be in the position that we are in today. But we have this impression that we must provide health care to the population. The population demands health care. I heard on the radio yesterday somebody advocating that the government of Trinidad and Tobago should now provide stem cell treatment. Government can't provide all these things for free. We have to decide what model of healthcare we want for our society. And if I have to stick true to my title as Minister of Health, not Healthcare, the Port of Spain Declaration speaks to that. If I am to be the Minister of Health, we have to have an intervention with children in the schools. And we have started that conversation with the soft drink manufacturers to come to us with voluntary cuts in sugar limits to drinks sold in schools. Because if I am the Minister of Health for the obese diabetic child today, I don't have to be the Minister of Health Care for that same child 20 years from now when they present our hospital to chop off their legs because they have uncontrolled diabetes. You see the difference I'm trying to make? From moving from being Minister of Health Care to Minister of Health. But the intervention that is needed is greater than our collective abilities so far. Because in Trinidad and Tobago, at least, we have made absolutely little or no progress in controlling the epidemic of diabetes, hypertension, high cholesterol. Those are the 3 highs we need to bring to 3 lows. So what is the plan? The plan is, as Minister of Health, we need an intervention to break the cycle of societal factors and genetic factors that lead Trinidad and Tobago to be a leader where we should not be a leader. This crown that Trinidad and Tobago wears as a leader in diabetes, Dr. Hospitalis is laughing. This crown that we wear, this trophy that we have as being first in the region when it comes to rates of diabetes and so on, is a crown I do not want. That's a crown of thorns, my friends. So as we start to implement policy driven by data, and you are going to discuss the data, I am not going to bore you with data. But as I put my size 11 foot into my mouth, I will tell you, unless we get our 2 main groupings in Trinidad to understand that whilst you can't control your genetics, you can control your surroundings, and you could control this deadly relationship you have between your hand and your mouth. That is, you could control what your hand picks up from your plate and shovels into your mouth. That, my friends, is what you have control over. I'm a poster boy for diabetes. I keep saying that. Genetics tells me I belong to the Indian or the Asian racial grouping. Predisposition for diabetes. Genetics will tell me my 2 parents were diabetics and suffered horrendous deaths due to complications of diabetes. I can't help that. Genetics will tell me I'm male. Life will tell me I'm 58 years old. So I am an East Indian, middle-aged male, born of 2 parents with diabetes. Those are genetics. I can't change that. But what I can change is what I eat, how I exercise, and how I live my life.